Dear colleagues, welcome back to the Endo channel by Gianluca Plotino. I'm really happy you are viewing this message from me because this is my view on dentistry and is a partnership that we have with the osteocom platform, a worldwide leader platform in web-based education in dentistry, and I'm really honored to have this partnership with osteocom. I am recording these lessons to give my fingerprint, to give my view on dentistry, endodontics in particular, but not only. So my vision of dentistry and endodontics is registered for you in this web-based platform. The channel is mainly related to endodontics, but not only. And in fact, this session is called Not Only Endo, and this is the version 2020. I have registered already some lessons about endodontics, and the last one of this lesson will be on post-endodontic restoration, the restoration of endodontically treated teeth. This session on that is called Not Only Endo is a session on comprehensive dentistry. What is comprehensive dentistry? Is the comprehensive dental care providing for full range of dental health services for diagnosis, treatment, follow-up, and rehabilitation of patients. So this is what I call a patient-centered approach. And this section of my channel is based on an interdisciplinary dentistry. So this is something that I day by day perform in my clinical practice in my office here in Rome, in the center of the city. I'm not only an endodontist, but I also take care about all the restorative part of my patient or the aesthetic part. And so we can say I perform an interdisciplinary dentistry. And the word interdisciplinary indicates an interaction between the involved disciplines in dentistry. Of course, interdisciplinarity requires a team which is highly interactive. And in fact, in my practice here in Rome, we perform multidisciplinary treatments with my associate there. For example, in this clinical case, a patient came with the fracture of the lingual cusp of this upper premolar with this big carious lesion and carious decay. The treatment was performed as soon as possible. I performed the endodontic treatment as soon as I could guarantee a correct isolation. And then, after endodontic treatment, my colleague, my associate, Ferruccio Torsello, the orthodontist of my clinic, has performed an orthodontic extrusion. So a multidisciplinary treatment with my orthodontist that in very few days, this is time zero, with surgical removal of the connective tissues in the sulcus, the fibrotomy, every 3-7 days, we obtained a very nice result in very few days. This is just after 40 days of orthodontic extrusion, we gained the ferrule that we needed to perform a temporary crown, and we splinted the temporary crown to stabilize the tissues. This is the radiographic appearance of this treatment, time zero, 15 days, and again with this orthodontic extrusion after 40 days. This is the appearance of the tissues at the time of the impression and the ferrule gained, and this is the final crown made by myself on this patient. So a perfect example of an interdisciplinary treatment with my orthodontist to regain this tooth and to put this tooth again in function. But whereas the ability of the involved colleagues to treat is limited to one area, interdisciplinarity requires a high level of information. So not only within one's own specialty, but also about the state of the art of all the involved disciplines. So it's required a multidisciplinary knowledge. And this is the message that I want to give you in this part of my channel, in this series of lectures. And this is always connected with the minimally invasive dentistry approach that I have treated throughout all the channel and all the lessons. And so in this Not Only Endo part, we will treat, for example, about a minimally invasive innovative method to arrest caries. and so to treat incipient interproximal caries lesion. Then we will pass through giving a look to digital impression and intraoral scanners and how this part can be implemented in your practice and can influence the clinical practice of every one of us. And then the last lesson of this Not Only Endo session will be about more comprehensive dentistry, including the concept align bleaching bond. So to align teeth, create aesthetic with bleaching and bonding restoration, to perform and to take care comprehensively to the health of the mouth of our patients. So I wait you all to take part on this session, to have a look on these multidisciplinary treatments on Endo channel and the Not Only Endo web series 2020.